Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Clozapine. Its brand name is Clozaril. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Clozapine. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Clozapine is an atypical antipsychotic. It antagonizes adrenergic, cholinergic, histaminergic, and serotonergic receptors. Clozapine also interferes weakly with dopamine binding at D1, D3, and D5, and moderately at D4 receptors. There is more dopamine blocking activity in the limbic region of the brain than in the neostriatum. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of treatment-resistant schizophrenia, and as well we can see this medication used in recurrent suicidal behavior in schizophrenia. With respect to contraindications or reasons we would not be able to prescribe Clozapine, well, we just wouldn't give this medication to a patient who had a serious hypersensitivity to Clozapine or to any other component of the formulation. Now, this hypersensitivity could present as photosensitivity, vasculitis, erythema multiforme, or Stevens-Johnson syndrome. Now, for dosing with Clozapine in treatment-resistant schizophrenia, we may see an initial dose of 12.5 milligrams orally, 1 to 2 times daily. You would then continue with daily increases in increments of 25 to 50 milligrams per day, as tolerated, to achieve a target dose of 300 to 450 milligrams per day, given in 2 to 3 divided doses, and you would try to achieve this by the end of 2 weeks. For maintenance therapy, dose adjustments should be made no more than 1 to 2 times per week, in increments not to exceed 100 milligrams. The maximum daily dose would be 900 milligrams. As with all medications, there are some side effects or adverse reactions that patients may experience while using Clozapine. We'll go over some of those here now. Some common side effects may include hypotension or low blood pressure happening 9 to 13% of the time. Syncope or fainting may happen 6% of the time. And 17 to 25% of patients may experience tachycardia or a rapid heart rate. Sweating may occur 6% of the time, and increased weight may occur in 4 to 31% of patients. 5 to 17% of patients may experience nausea, and excessive salivation may happen 13 to 48% of the time. Xerostomia or dry mouth, so going in the other direction here, may happen 5 to 6% of the time. Dizziness may happen to 14 to 27% of patients. 7 to 10% of patients may experience a headache, and up to 46% may experience somnolence. 6% may experience a tremor. Visual disturbances seem to happen 5% of the time, and a fever may happen 5 to 13% of the time. Now for serious side effects with Clozapine, so this is a longer list than what I'm presenting here. I'm just providing a couple of examples, so keep that in mind. And if you're interested in more serious side effects, just research that. So prolonged QT interval, or orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. All right, everybody, that's all we're going to talk about today with Clozapine or Clozaril. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.